some more that'll join us as we go on, and I'll just keep a watch on that and admit people as they come in. So, good afternoon, everyone, and welcome to today's webinar, Dosage Calculations. I'm Dr. Monica Briggs, the Project Director for the Tennessee Center for Nursing Advancement and the sponsor for today's webinar. The Tennessee Center for Nursing Advancement is dedicated to supporting and empowering the nursing workforce across our great state and in the Appalachian Highlands. Our mission is rooted in advocacy, education, and collaboration as we work to strengthen the nursing profession, address workforce challenges, and ensure the delivery of quality care for every community in Tennessee. We serve as a resource hub for nurses, healthcare organizations, policymakers, and educators, providing critical insights, tools, and initiatives to tackle current issues and prepare for the future of healthcare. Whether it's through workforce research, leadership development programs, or partnerships that bring meaningful change, we are committed to advancing the role and impact of nursing in every corner of our state. Today's webinar is a chance for us to connect, learn, and explore how we can continue to make a difference together. Before we dive in and introduce our speaker, let me take a few moments to cover a few housekeeping items for today's webinar. All participants, please remain muted during the presentation to minimize distractions. If you experience any technical difficulties, please use the chat box and our team will assist you. We encourage you to ask questions. Feel free to type your questions into the chat box at any time during the presentation, and we'll address them during the designated Q&A session at the end of the webinar. This webinar is being recorded. A copy of the recording and any shared material will be sent to all registered participants afterwards so that you can revisit the information or share it with colleagues. It'll also be posted on the center's website at tcfna.org. Let me admit somebody. And all participants will receive a participation certificate via email after the webinar. And at the end of the webinar, you'll receive a brief survey. Your feedback is incredibly valuable to us as we continue to improve and deliver meaningful sessions like this one. With that out of the way, it's my pleasure to introduce today's speaker, Jill Cooper, affectionately known as Nurse Jill. Nurse Jill is a dedicated nursing educator and proud East Tennessee State University alum. A first-generation college graduate, she earned her Associate of Applied Science in Nursing with the highest honors and later graduated summa cum laude from ETSU with a Bachelor's of Science in Nursing and a minor in Trauma and Resilience. An award-winning tutor and the 2024 Tennessee Valley Nurse of the Year, Nurse Jill is passionate about helping students master dosage calculations and build confidence in their nursing skills. Through her platform, nursingmathtutor.com, and her instructional book, Nurse Jill's Simple Dosage Calculation, she has helped thousands of students succeed. Please join me in welcoming Nurse Jill.
Hey, thank you, Dr. Briggs. What a sweet introduction. I appreciate that so much. And all of that is thanks to my students and my amazing professors that I've had, or I would not have been able to accomplish anything like that. So thank you so much. But I'm humbled to be here today, and I'm so excited to talk about something that a lot of people try to avoid, but dosage calculation. So I hope by the end of today's webinar that if you're not comfortable with it to begin with, that you'll feel a lot more comfortable with it at the end, because dosage calculation is fun and it can be pretty easy if we just stick to a few rules. So I am going to share my screen and we are going to look at a few things about dosage calculation, starting with some about the background and a little bit of why nurses do what we do when we're calculating medications, because that is one of the most important parts of our job for sure. And so a lot of this is adapted from my book, which you can see behind me, and that's available on Amazon. And I have just created a workbook with over 400 practice questions as well, that will soon be published, but it's available as a PDF if anyone needs that for practice questions. But we want to get everyone comfortable with this. So learning essential skills. So yes, as Dr. Briggs said, I've been tutoring nursing students for several years now. I've been a nurse myself for going on about 15 years, but my journey with tutoring nursing students began when I was a student myself. Back in chemistry, I saw where there was a really dire need for people to understand how to set up equations. That's where it started. My friend and I created some different terminology for it. She called it the flip-flop method, and that was a way that she remembered how to set up the equations. But as I got into nursing school and I started seeing students that were really struggling with this, it became a personal mission to make sure that no student that I was able to help at least could be left behind or fail because of dosage calculation. So it's a really important part of nursing, but it's also a part that can be made easy as long as, students practice and us, tutors or professors, we keep in practice too. As I tell my students, math is really easy to learn, but it's a whole lot easier to forget. So I really do advocate for students doing, several practice questions most days until they get really comfortable with this, and then, 2 to 3 a week. So my tutoring platform is nursingmathtutor.com. Started that a few years ago just to kind of hopefully reach more students all around the world and help, with anyone in any type of nursing school, whether it's LPN, RN, to BSN. I've had a few students who I've helped that are in their master's and their doctorate. And the good thing about this is it works no matter what. So we hope to help overcome fears. For our agenda today, so learning objectives, we're going to understand a little bit about the history and the core principles of dosage calculation for safe medication administration. It's very important to support this in the clinical setting. I can't emphasize enough how important knowing how to set up medication administration problems is. And I know as soon as students begin nursing school, they're hit with this really early on. And one of the first proficiency exams that we have to take is in dosage calculation. And most schools, the further that you progress, the higher accuracy you have to get to the point of you've got to be able to make a 100% on this. So this is something that needs to be mastered as early on as possible. We also have, a little bit of a different spin. So the method that I really prefer is based on dimensional analysis. That's really the underlying principles of it. I mixed in a few little algebra concepts in here, and the reason is because I feel like if students can understand a pattern to dosage calculation, then they can learn how to set up the equations very methodical, pretty much the same way each time. So there's a little bit of personal emphasis on algebra and different concepts in the method as well. But we're also going to look at some example scenarios, and that's what I'm most excited to share with you guys. And I appreciate Dr. Briggs and Mr. Carl, everybody who made this possible on Zoom, because this is the platform I use for my students whenever I'm tutoring with them. It just makes it so easy to share my screen and to work the problems along with them. And so that's what we're going to work on as well today. And then at the end, as we have time, I would love to hear from you all. If you have questions, like Dr. Briggs said, you're welcome to put those in the chat. If you have questions at the end and we have time for a few dosage calculation ones, I'm pretty strong auditory. I don't really have to see them. Usually, if I hear them, and I'm putting myself out there for this. So you might find one that stumps me, who knows? But those are always fun. So I'm a human too. So sometimes there's something I need to do more research on. And that's always exciting, because the great thing about being a nurse, as many of you know who are already in healthcare or who are already nurses, is it is a career that is endless. So we continuously learn. There is nothing that we're going to know completely 100%. And so that's one of the exciting parts and one of the passionate parts that I've always had about becoming a nurse. And I have my mom and my sister to thank a lot for encouraging me to become a nurse, and my little girl for inspiring me to become this, because it's not just a job, it's a calling. And nursing students are one of my very favorite genres to help work in. Some of the history of dosage calculation. So, most of you have probably heard of the apothecary system. This is taking us back a long time ago, but there were some really cool aspects of this. We talked about grains, drams, scruples. There's all kinds of different terminology from this era. So, this is kind of some of the roots that dosage calculation was formed in. Now, we transitioned to the metric system in modern day medicine, of course. And that's how we started developing different formal dosage calculations and different exams to make sure that, we're prepared to go into the medical field and to make sure that we give patients the correct amount of medicine. Because even though, as we know, the doctor, is the one prescribing or the nurse practitioner, it is definitely the nurse's job to make sure that everything is accurate. And another thing I always stress with my students is if you're not sure, clarify the order. So that's so important. And again, we all can make mistakes, we all can have errors. And so the beautiful thing about nursing is that we're a team. And so we can always, help each other, double check each other, make sure that, things are as they're meant to be. Now, one caution I will have, I really like AI for a lot of amazing things. It's really good when you're doing research. Sometimes you can find out, some things that can lead you to the right places to study. I warn against it for dosage calculation, though. I have tested it many times with dimensional analysis, and most often it will get questions wrong. So, this is so important for us to learn, 100%, not to ever depend on computers or even calculators, although, we're blessed to have computers and calculators to do a lot of the problems and things for us, but we always want to make sure that we know how to calculate things and don't ever trust something, that's not a real human with being able to calculate these 100% because there are errors that it can make. So definitely important understanding of how this method works. So, what do you think is one of the most common errors that nurses make? So, obviously, medication administration, accidentally giving the wrong medicine, having the wrong amount. And sometimes this doesn't cause severe harm to the patient, but what if it did? And a lot of times it has, and many times it can. So, nurses are so responsible for our patient's safety. As you'll recall in nursing school, if you've been a student, one of the first things we learn in nursing school is that we are the patient's advocate. So no matter what, we are on their side, we're their cheerleader. We want to make sure that they have the best possible healthcare experience. And an important aspect of that is keeping them safe. Many of you will remember if you've been in nursing school or are a student now, Maslow's hierarchy of needs. So you remember that the bottom hierarchy is physiological. That one's always a really high priority whenever we're taking exams or we're considering our NCLEX license exam. We have to take care of that patient's basic physiological needs first. That's prioritizing things like the ABCs, anything that they need to keep them alive, basically. But right above that is safety. And we know that safety is so important when we're thinking about medication administration because not only does it keep the patient safe, but it also adheres to that principle of taking care of their basic physiological needs first. So, dosage accuracy ensures safe practice across all types of medications. So, we have oral, IV, pediatrics, especially. If you've been a student, you know that pediatric dosage calculation is one of the most important because it's weight based. Most of it revolves around, how much a patient weighs, determining how much medication they get. And safe dose range, we'll look at some of those today as well, but that's primarily based on the patient's weight, and we can't be wrong even just a little bit. All right, so dimensional analysis with a twist. So, fundamentals of dosage calculations, we've got conversions. So, my students hear me preach this every time that they're with me, just about it. And my dad was a Baptist minister, so I can get long winded on things like that pretty easy. But conversions are so important to have memorized. As soon as you have that dosage calculation test thrown at you, you better know those conversions because they're likely not going to be on that test for you. And most of those are really simple. We always remember that 1,000 micrograms equals 1 milligram, 1,000 milligrams equals 1 gram. But sometimes you might get to the trickier ones, like, most of us know that 1 kilogram is 2.2 pounds, but do we know how many centimeters is in an inch? That matters when we get to the body surface area formula, and that's specifically found in pediatrics courses. So remembering 2.54 centimeters is in 1 inch can help us convert a really difficult looking, equation, which involves a square root and things like that. But if we don't know that, then we may not ever be able to get to the right answer. So conversions, I cannot tell you enough how important those are. Now, some other methods of dosage calculation. So we have ratios, we've got proportions, and a lot of people like to use those methods. We'll look at too, a lot of people like to use desired over half times quantity. And I am not someone to tell anyone to use a method that they're not comfortable with. So if someone's gotten really comfortable with one of those methods, then I think they should stick with what works well for them. However, when we get to longer equations where we're having to use a lot of conversions, we're having to do more difficult types of scenarios, that's where dimensional analysis is so proven to work so very well. And so if we begin with using this method, which, is primarily dimensional analysis with the easier questions, then we can continue that when we get to the harder questions. And it becomes kind of a second nature. So I can't tell you how many times I've actually dreamt about dosage calculation. I enjoy it so much. I'm a nerd, for one thing, but it kind of gets in your brain. And so once you get really comfortable with this method and once it clicks and you see the pattern, then it's just like, it seems to work with most every type of dosage calculation question, aside from a few, and we'll talk about those. So step-by-step method for administering, any of these medications, and it helps to prevent errors. So again, this slide has just a little bit about, our conversions, again, how important those are. And again, the other methods, they work for many, many practice questions, but there are limitations sometimes with the multi-step or advanced problems. So that's why I really recommend getting the method you're comfortable with, which will hopefully be this one. But if you've got another one, that's fine too. But get the method you're comfortable with and stick to it. And so ones that are based in dimensional analysis will help you tremendously. All right, so things that I teach my students when they're learning this, because my goal to have students is when they just enter nursing school or before they even begin. So occasionally I'll have students stumble upon my website who have gotten into nursing school already and they want to get a head start on learning dosage calculations. And so they will come to me before they even begin so they can start learning this to make it easier once they start. That is like golden. If I get a student that has never been tainted with different ways of learning or different methods, then they can learn really quickly and very easily. But most of us have been exposed to a lot of different methods. And again, I'm not saying those are wrong. They're not. A lot of times they work very well for questions and they work well, for certain learning styles as well. But if you can learn this method and adhere to these 7-ish rules, then this will absolutely help your journey be easier. So rule number 1, always identify what you're solving for. And we'll look at that in just a moment with the setup. I think it comes on the next slide. But the way I set mine up is I always want to look for the labels that I'm actually looking for. So for example, if a question wants to know how many milliliters per dose, the patient's going to get. I'm going to always set my equation up with milliliters over dose equals. First numerator factor to the right of the equal sign always matches what you're looking for to the left of the equal sign. So if I have my equation set up milliliters over dose equals, I know that the first numerator label I'm going to start with is milliliters. So it's always going to be that way. Rule number 3, we can flip factors upside down if needed. So this one is kind of odd to some, especially if you're not used to doing it this way. But when we have factors in a question that are connected with a fraction bar or with the word per, for example, those are connected together. A lot of times I'll call those the twins, or some of my students say that they're married. And so we want to keep those together. Now we can flip them upside down to keep this matching pattern going, which you'll see in just a moment. But we want to keep those together. And this is just basically for accuracy. So what's on bottom is always going to match the next top label. And it's going to keep going in that pattern. So every label comes in pairs. So I tell my students to think of Noah's Ark, 2 of every kind. If you've started with milliliter, and let's say you have milligrams on bottom, you know that the next top label has to be in milligrams. And then it's just going to keep going. Let's say you have micrograms on bottom of the second milligrams. You're going to have micrograms on top. And again, the visual will help with this in just a moment. We want to keep factors attached and do conversions within the equation whenever possible. Now, a lot of students do prefer to do the conversions separately. And again, if they're comfortable with that, then I don't want to try to teach them to do something to make them uncomfortable. If it's working for them, then, we want to always adhere to that. But if you're open to it, then keeping conversions within your equation will actually help eliminate error, and it keeps more precision. So a lot of people like to do the conversion for weight separately and then add it into the equation. But if we do it within, then we let our calculator basically do the math for us as long as we are setting it up correctly. And then we have 3-factor questions, safe dose ranges, weight-based problems. So these are some things we'll look at as well. All right, so we're going to look at our first question, and I'm going to split my screen just like I do in a session. And let's zoom up on this so hopefully you can see this a little bit better. Okay, let's see. All right, we have this first one. All right, so example question. So this is a common conversion question. So we've got 678 milligrams equals how many grams? So again, this one's really easy. There's so many different ways that you could do this and get the correct answer. But if you want to start off with learning this method so you can continue it with harder questions, then you are going to start it with what you're looking for. So I'm going to do grams equals. And I know that my grams conversion, again, this is something we always have memorized, is 1 gram over 1,000 milligrams. Then I'm going to, since I've got milligrams on bottom, I know I'm going to have milligrams on the next top label. So this is where we're going to incorporate the 678 milligrams. So very simple. Again, you don't have to even set it up this way. You could just simply say 678 divided by 1,000. But the reasoning for this is because when equations get longer and they get harder, you're already used to setting it up this way. So I'm looking for grams. I know I have to start with grams. And then since I've got my conversion that I start with, I have milligrams on bottom, and then I have milligrams on the next top. Now, a lot of students like to have a denominator on bottom so they know how to close their equation, what they're ending with. And again, for the longer ones, this will definitely come in handy. So you can put it over anything. Some people choose X, some people choose 1. I like to put it over dose just because I know I can always put 1 dose on bottom and I know I can end with the label that I'm looking for. So very simple, but when we calculate this, we should get 0.678 grams. And we'll talk about this in a couple more slides, but we're going to round that to 0.68 grams most of the time. And that's because we're going to use what's called the universal rounding rules unless we're told to do otherwise on a test or a practice exam. All right, so that's a very simple one to start with. All right, we have another one, which is more of a nursing school type of scenario that we might see. And so for this one, we've got the doctor orders Med Z 0.3 milligrams PO BID. All right, so first thing we want to do is make sure, again, that we know exactly what all of these abbreviations mean. And most of the time when you begin nursing school, your professors, will give you a list of these or they will be in your books on the syllabus somewhere, but you definitely want to make sure all these are memorized at all times. So we know PO means by mouth and BID means twice a day, which would also be equivalent to 2 doses per day. We also have a couple more, that we would want to have memorized, and one of those would be TID. If we see that, that's 3 doses per day. So just for an example of things that we might see. Now we also have supplied is 0.2 milligram tablets. So how many tablets? So first thing, we want to identify what are we looking for. So for this one, we know we're looking for tablets. So I'm going to put tablets or tabs equals. Now it doesn't tell me per day or per something. So if it doesn't say, then I'm just going to always put that over dose myself because that's the denominator label I like to end with if I don't have one specified in the question. So we take the label tablets or tabs, and we know we got to start with that. If I'm looking for tablets, I always have to start with the label tablets. So I know that 1 tablet has 0.2 milligrams because it tells me that in my question. It says that it's supplied as 0.2 milligram tablets. Next, I want to look at what did the doctor order. So they ordered 0.3 milligrams. And you see how we've got the pattern. We have milligrams on bottom and we've got to have milligrams on top. So it goes with the matching type of pattern. Now the BID, so the question here with students a lot of times I will come across is, where do I use the BID or do I use that? Do I need 2 doses a day? And the answer is no. So the only reason you would use the BID is if you were looking for tablets per day. But since this just says how many tablets and it doesn't specify per something, like we said per day, then we know we're going to close with dose. And so we know they're just going to get 0.3 milligrams per dose. So there we've ended with dose and we've started with tablets, and then we have 2 of each kind in between, like our Noah's Ark that we said. And so we're ready to put this in and figure out the answer. So you could also just simply put in 0.3 divided by 0.2, which is fine. But again, like we said, as we get into the longer and longer equations, if you can have this visual set up, a lot of times it's very beneficial. So if we say 0.3 divided by 0.2, we should get 1.5 tablets. And most of the time, our questions will tell us if this is perforated or a scored tablet. We know we can break those in half. But for most questions, whether they say, again, usually a half is acceptable, but it depends. Always follow, whatever instructions that you have on your practice test or on your actual test always. Another thing that I had a student not too long ago come up with this, which I really liked it, what it said. I thought that was cool. So she called it the rainbow method. which makes sense when we're setting up questions. So for this one, it doesn't really ask you a question like how many tablets or how many milliliters, but it does say that the medication is ordered as zero point 0.3 milligrams IM, which we know means intramuscular, and is supplied as zero point 0.2 milligrams per ml. So this fraction bar is the same as the word per, which just means that those two are connected together, is a good way of thinking of it. It doesn't tell us what it wants the label in, so what our answers should be in. But when we see a liquid, if we see milliliters, that's a sign that, we're going to need to figure this out in milliliters. Another thing, we know that it's IM. So if it's an IM injection, we know that's milliliters. And then we also have 2 milligrams. So we know we can only have one of the label for, so that's another way. So there's a lot of hints usually that you can remember. So for this one, we're going to look at milliliters and we're going to put it over dose because there's nothing that says we need to find per day or per hour. So even though this says 0.2 milligrams slash ml, we're going to flip it and we're going to put 1 ml on top. And the reasoning for that is, again, this pattern. So if you're looking for mLs, you're going to have mLs as your first label that you start your equation with. These are attached with a fraction bar. So we know that 0.2 milligrams has to go on bottom. So that's what's available. That's what we have. Now we have to figure out what the doctor ordered, which is 0.3 milligrams. And we're just going to put that over one dose because we don't have any kind of time components or anything like that in this question that we need to solve for. So when we put that into our calculator, again, we just get 1.5 mLs, and you can put it over dose or, however you choose to do that or however your question asks for. Okay, the rainbow method, why it's called that, I guess I should clarify. So one end of the rainbow matches the other end. So if you're looking for mLs, then that's going to go to the left of your equal sign. That's going to be the left side of the rainbow. And then you're going to have the right side of the rainbow match what comes to the right of the equal sign. So, and then if we have dose on bottom, then that's kind of our upside down rainbow. And it's silly things like this that can sometimes just help us to remember, depending on what type of learner you are. Again, a lot of people are visual, primarily. A lot of people are kinesthetic, auditory, and most of us have a mix of different learning styles that we prefer. So just find out what works best for you. If it helps you to see visuals like that, then I would absolutely recommend them. All right, so here's an IV practice problem. So we get a lot of IV questions in nursing school for sure, and that's something important that we want to know how we're going to administer that to our patient. So for this one, we have our example question, we've got our order for amoxicillin, we've got what that's mixed in, and we have an hours component. But the first thing we want to identify is what are they asking us on this? So they're asking us to calculate the GTTs per minute or drops per minute. So I'm going to start with GTT over minute equals. And just like we've been talking about, we know that first label has got to be in drops. So again, rainbow method. All right, so we identify in our question what we have in drops. So see if you can identify that. It's pretty easy right there. So 20 drops. All right, our next rule, we know that's got to stay attached to the milliliter, right? Because they're attached together with that fraction bar. So put that over 1 ml. Next, you got to choose what are you going to use. You've got 500 milligrams, you've got 100 mLs, you've got 1.5 hours. So go with the method. If you've got milliliters on bottom, you have to have milliliters for your next top. So what we have is 100 milliliters. Now for this one, it's a little tricky. So a lot of times we might want to put that over 500 milligrams. But if we did that, I'm going to have to go down to this next line. Do we have another milligrams to match it to? Or do we have grams or micrograms, anything that we can convert it to? We don't, right? So we know that that is not what we need to use. We need to go with the time component because we got to get to minutes ultimately. So I'm going to put this over 1.5 hours. That's the other component. And we know we're giving it over 1.5 hours. And then at the end, I'm just going to put my 1 hour over 60 minutes conversion. So that way I let my equation do the work for me, and I'm ultimately getting to minutes at the end. And then I have two of each kind in between, and then I'm done. So when you plug this into your calculator, you probably, depending on what kind of calculator, and that can make a little difference. So if you are a nursing school student, use a basic calculator. Get the cheapest one that you can find and practice with that because that's very likely what type you'll be given during your test. Sometimes they'll have you do your calculations on the computer if you're taking ATI or something like that, which is fine, but I do highly recommend doing a basic calculator versus a smart calculator because the rounding can be slightly different on those. So if you're using a basic, you're going to get lots of twos after that decimal place. But one rule we always remember with drops is that can you divide a drop? No, right? So we're going to round it always to the whole number. So 22 drops per minute. So just another simple thing that we want to always keep memorized. Okay. Sorry, I'll probably have to back up a little bit on this one. If it gets too small, Dr. Briggs, if you don't mind to tell me, because I know when I'm sharing my screen, sometimes the PowerPoint or something can look a little small.
It looks good.
Okay, thank you.
You're welcome.
All right, so for this one, we have got practice problems. So we have safe dose range 4 to 10 milligrams per kilogram per day. The pediatric patient weight is 64 pounds. So how on earth do we know how to solve this when we get one like this? And this is usually where students will start to have that anxiety level move up to a moderate from a mild a lot of times. So this one can get tricky, but you know that you always go by the rules. And those rules can carry you to where you need to go. Unless, like I said, sometimes in peds we'll get like a body surface area or something like that, and we'll address that a little bit in a moment. But for safe dose range, most of the time, if they don't ask you what they want the labels in, then you're going to look at the one that has three factors. So you see how we've got milligram per kilogram per day there, and we have the hyphen 4 to 10, 4 to 10. So this tells us that we're going to have a low end, so the very lowest this patient can have, and we're going to have a high end, or the very highest this patient can have. If they don't tell you what they want the answer in, then look at the first and the last label. And we're going to set our equation up like that. So we're just going to say milligrams over day equals. Now, if they specifically say they want per dose or anything about dose, then put it milligram per dose. And then if there's a component, you're going to add that in. But for this one, we're just going to say milligrams over day. And we're going to say 4 milligrams because that's our lowest. We know we always start with milligrams, which is what we're looking for. And when you are in that 3 factor, do them in order. So put it over 1 kg because that comes next. And then you can do it one of 2 ways. So I just prefer to do mine 1 kg over 2.2 pounds times 64 pounds. That way I've incorporated the patient's weight and I've allowed my equation to do the work for me. But you can certainly always do your conversions separately again if you choose to. So you would just want to convert it to kilograms, and then you would want to plug that in instead of doing this conversion factor. So again, that is personal preference. What I do caution students about with weight is sometimes, again, you can be 1, 2 decimal places off. So if you are converting to kilograms separately, and if it comes up with a decimal place, I recommend rounding to the hundredths to get an accurate equation or an accurate conversion, sorry, versus the tenths. And sometimes just putting the weight completely as it is with however many decimal places is the absolute best choice if you're doing it separately. That way you do get very accurate with it. But if we do it within our equation, that works out well, and then put that over 1 day. Now, if you had to do your high end, then everything else stays the same. We just cross out our 4 and we put a 10 in place of that. And so that's going to get you the low end to the high end that that patient needs. So that's how we would do a simple safe dose range. All right, so for this one, this slide, we have got common errors and how to prevent them. So some of the most common ones that I see, accidentally misplacing decimal points. It sounds so easy, but it is something that a lot of us have not practice since we were maybe in school, maybe in elementary, middle, high school, so this is something that's easy to forget. So remembering how to do those, brushing up on that practice, forgetting your conversions. That again, I cannot emphasize enough how important it is to remember your conversions. And I've got in my book your most common conversions that you always want to have memorized. Skipping dimensional analysis, again, personal preference, but it works. Just trying to adhere to the method, and then not double checking your work. So I might get really fast whenever I'm doing practice questions at home, but if I'm going to sit for a test, I want to go through that equation at least twice. If I have time, maybe 3 times, but twice is good, to make sure you didn't accidentally miss setting something up. And then relying solely on calculators and computers. So again, AI is just not really good with doing these. So I would not recommend using AI for doing dosage calculation. For your calculator, as long as you've got this method set up correctly and you're punching things in the calculator correctly, again, run through it twice, then you should not make a mistake. All right, so reconstitution. So practice problems with this. Okay, so for this one, a lot of times with reconstitution, there's a few components, sometimes 1 or 2, but sometimes more than that, that you want to learn not to use because it's not the end result. So this one's a rather simple one. They get harder, but for this one, it says how many milliliters will you administer? So we're going to, again, put it milliliters, and I'm going to do mine over dose. So that way I know what I'm starting with and I know what I'm ending with. So we look in our question and we find the label milliliters. So we have 2, right? We've got 1,000 milliliters, and then we've got the 125 milligrams / 5 ml. So how do you know which one to use? So most people will know probably that you're going to use the 125 milligrams / 5 ml because you have to also use the doctor's order, which is 200 milligrams. But if you weren't sure, then some hints that you want to find are we have the word reconstitute. So reconstitute is a hint that something's going to be changing and you're going to have a final product. And then we also have those words final concentration, which is kind of the typical language for reconstitution types of questions. So you want to use the end product that you will have. So for this one, you would want to use the 5 ml, and then you're going to just flip it. You're going to use the 125 milligrams on bottom because, again, they're attached with that fraction bar, and that means I keep them together. Then you're going to multiply that by the doctor's order, which is 200 milligrams. And I'm just going to close mine out with 1 dose. So I know that I'm going to end with the label that I'm looking for. And I'm going to have 2 of each kind in between. So for this one, you should get 8 mLs, and that's going to be per dose. But watch for those words, reconstitution, final concentration. There's usually one or two things that could try to tempt you to use them, but if you follow again this pattern, then you hopefully won't choose the wrong one. We also have bolus and infusion. So heparin, that's a really important medication that we give to patients a lot of times in the hospital, the nursing home setting, but certainly after surgery, this is one that we could see given to patients. These are questions that we get a lot of also in nursing school most of the time. So when it asks you to calculate the heparin dose, you want to pay attention to, is it asking us for the bolus or the infusion? Because usually heparin questions are set up to have both in them. And so you want to know which one you're going to be using to calculate the correct dose. So for this one, it says calculate the units of heparin for a bolus dose. So I'm just going to do units, and I'm going to do this over dose. And then I'm going to look through my materials that I have, and I know that the bolus dose is 80 units per kilogram. Now, I also have the infusion, which is 18 units per kilogram per hour, but this only wants to know the bolus. What am I going to give right now? We're not concerned with the infusion or a time component for this one. So I'm going to choose the 80 units that's attached to the 1 kg, and then multiply that by, we know if we got kg on bottom, we got to have kg on top. So the students, look at me, the patient's weight, 96 kilograms. And then I'm going to put that over 1 dose. So with that, after we calculate, I think we should get 7,680 units, and that's for the bolus dose. Watch, a lot of times they will ask you to round heparin units per dose to the hundreds place. And remember, hundreds is not the same as hundredths. Remember, if it's got that TH on the end, it's going to be the numbers that come after the decimal point. But if they ask you to round this to the hundreds, then, you just look at what's in the tenths place, and you know that you round that to 7,700 units. So simple things like that are what I can see students making mistakes in a lot of times. It's because, just not remembering simple rounding rules, things like that. So always make sure that you're comfortable with those. Now, same problem, but for this one, it wants to know the infusion rate. And so for the infusion rate, we're going to ignore the bolus dose, right? Because we want to know a rate, and rate equals time. So I'm going to go towards the one that has the hours attached to it. And I know that it's going to be in units. And it's going to be in, units is not correct on that one. It's going to be in milliliters. Milliliters per hour, because that's how we would program our IV, is milliliters per hour. So ml over hour equals, and so we go through the whole process with this one. So we have 250 ml, those match. That's attached to 25,000 units. I'm just going to put a U for sake of space. And then I go towards my infusion, because that's what I'm calculating, which is times 18 units. And I'm going to put that over my 1 kg, and then times 96 kg, and then end it with 1 hour. Now, with this one, again, you can see the pattern. You're starting with milliliters, you're ending with hour, you have 2 of each kind in between, and you're done. So what about the 100 units slash ml that's in parentheses there? So if you have something that's in parentheses, then that's its converted form. If it's beside, something else, some other numbers and labels. So you can use either one, but just pick one. So for this one, I did 250 over 25,000, but I could have did 1 ml over 100. and we would end up getting the same answer. So that's kind of cool. So this is an input and output. I'm not going to work through this one for sake of time, but for input and output, just remember the main thing that you want to recall about those is that you want to do them all separately and you want to add them all together at the end. And also, I would caution you to watch about, so sorry, I'm trying to find that slide after I pulled it down. Yeah, watch about ice chips. So most people know, but ice chips are divided in half because they melt down. So whatever quantity you have, you want to divide that in half. You want to convert everything to milliliters is typically what your answer is going to be in. And so those are pretty self-explanatory besides that. And then watch about if we have calculate the intake and output for the 12-hour shift, then you want to make sure that this 125 mLs per hour in that question, you want to make sure that you multiply that by 12 hours because it's not just going to be 125 that you'll add. It'll be that times 12, of course. So some important rounding rules, again, we've got universal rounding rules, which say most of the time if a number is a whole number, meaning it's 1 or greater, we want to round it to the tenths place if it has a decimal place. If it is a number less than 1, meaning it starts with a 0 point something, we want to round it to the hundredths place. Now, drops per minute, again, are always rounded to the whole, and then sometimes you'll get different instructions on your practice exams or your actual test. So always pay attention when you're doing this to make sure that you're rounding to what they ask you to. And anyone who would like this slide, you will receive that. And so this has some more about those rounding rules on there. Also, we have some conversions. Again, these are some of the most common ones that you'll want to always have memorized. So if you're a student, then this could be very beneficial to you. So just let us know if you would like that. And Dr. Briggs will help me get that to you. We also have a body surface area, like I said, sometimes in peds that we will get this. And so this is an exception to, the dimensional analysis setup. This is something that we do with a square root, but it's pretty simple as long as you remember this formula that we have here. So that would be a good place to remember that as well. And then I have a few more practice questions for you if you do want this PowerPoint presentation. I'm making the one available with the answers on there. So you'll have that. So you won't have to try to, do this blind without having instructions. So the one that you will receive is the one with the setups and with the answers. Lastly, because we've only got about 5 minutes and you've been so nice to share your lunch hour with me or whatever time you had set aside with me. So I want to make sure that I've got enough time for questions if you guys have them at the end. But this is a multi-step problem. And this one is also on the handout. But this one can be something that is a lot more complicated for students if they're not comfortable with this method. So again, you're going to still do the same setup with these that are really, really complicated. And you just want to adhere to this method and this pattern. And so these are styles that are built to kind of go off each other. So for A, you would figure out the patient's weight in kilograms. For B, you would figure out how many milligrams per kilograms per 24 hours the patient is receiving. And then, knowing if the order is safe. So this one, if you're not comfortable with these, I would definitely suggest the handout. This is my website. Again, if you ever need to schedule a tutoring session, you can find me here. This is my assistant, Iris, who is happy to get you on the schedule. I also work for my friend, Dr. Robin. We teach middle schoolers biology. She created a really cool program, so we do that together as well. But we want to help the next generation. So that's kind of my goal is the new, generation of nurses coming on that they are comfortable with dosage calculation, but then those who have been nurses for a long time, like myself and others, that we are comfortable with those always. So I guess that ends my presentation, Dr. Briggs. Thank you all so much.
Right. Thank you, Jill. We appreciate you. And we do have a couple of minutes. If anyone has any questions, please feel free to unmute yourself and ask, or you can also put it in the chat.
Yes. If you have a dosage calculation question, you guys are also welcome to let me know. I'll be happy to help you with that. We got a few more minutes. They can get tricky sometimes in school.
No one has any questions. You did such a great job in presenting it, Jill.
Thank you. Maybe they're all pros. That's right. That's what we hope for sure. So I know you guys can do it. I promise you can do it. If
I,
I can do it, you can do it. That's
I
for
just want
sure.
to make a comment. Jill, I like your suggestion of using dose for the denominator when there's no time. I used to
Thank you.
use X, but I like the dose better.
Yeah, thank you, Patty. Yeah, that kind of just gives us a way that we know that's our ending. It's kind of like a map. You know
Yeah,
the
I like that.
beginning and you know the ending. Thank you. I'm so glad. Thank you. It's sometimes little things like that, Dr. Briggs, that can make it easier for people. Just something, that's what has helped me at least through it. So, but I love dosage calculation. You guys know where to find me now. So feel free to always reach out and I will absolutely be happy to help you.
And I will be sending out an email after this that will include the PowerPoints. It will also include the recording. And Jill, if you're okay, I can include your email address in that email so that they can reach out to you if they have any questions. Is that all right?
Yeah, I'd love for you to. Thank you so much. Yeah, that's my passion in life is helping students or other healthcare, people that need help. So we all help each other.
Well, I do want to thank you all for joining us today for the webinar, and special thanks to you, Jill. As always, you presented so well, and we love having you a part of the center. We do truly appreciate everyone taking the time out of your busy schedules to invest in your personal and professional growth. Your dedication to advancing your career and the nursing profession as a whole is inspiring, and we do hope you're leaving today with valuable insights. Before we wrap up, I do want to remind you that or I will be sending out an email shortly containing a participation certificate and access to the recording. Additionally, in the email, there is a short survey, and we would greatly appreciate your feedback to help us improve and tailor future sessions to your needs. And again, thank you for your participation, and we look forward to supporting you as you move forward in your nursing career. I hope everyone has a wonderful day.